Hi, and thanks for being with us today. My name is Debbie Garza. I'm a pharmacist and the CEO of the Texas Pharmacy Association. With me today is Dr. Leonard Friedland, who is a pediatrician, a vaccine research scientist for GSK, and he's been involved in the development of 14 vaccines currently in use across the United States. He's a member of the National Vaccine Advisory Committee, and he's passionate about vaccines. I'm thrilled to have him here today with us, as we'll be talking about the importance of getting your flu shot and other vaccines. So welcome, Dr. Friedland.
Thank you, and I'm thrilled to be here as well.
How important is it for children and young adults, for that matter, to get their flu shots with school starting back, knowing some are back remotely, some are hybrid, and some will be going back full-time here in the near future?
Oh, it's so very important, especially now with our COVID pandemic. Of course, influenza vaccines are recommended for everybody above the age of 6 months. Influenza has a tremendous impact on our healthcare systems. Besides the tens of thousands of deaths that occur every year in the United States, there are sometimes hundreds of thousands of hospitalizations and millions of office visits, lots of missed school, missed work due to influenza. And this year, if people are needing to go to their doctor's office for influenza, or they're going to the pharmacist because they want some medicine that's going to help them as they are experiencing the signs and symptoms of influenza, or they're going to the emergency department or being hospitalized, they're going to potentially overwhelm the healthcare system, which could be potentially overwhelmed with COVID as we potentially see a surge. And we don't want to be taking up office space or pharmacy space or emergency room space or hospital beds or even ventilators with people with influenza. And so because of that, the Centers for Disease Control has put a very, very important message out this year, which is that more so than ever, our population needs to be vaccinated with influenza. Typically, let's take last year, something on the order of 160 to 170 million people are vaccinated against influenza. This year, the goal is to have more than 200 million people vaccinated against influenza, and hopefully even more. There's enough vaccine available through all the vaccine manufacturers. It's already shipped. It's available in the pharmacies, and it's critically, critically important. Let's take off the table what we can. We don't have a COVID-19 vaccine yet, but we do have influenza vaccines. And we have other vaccines that can also protect against respiratory diseases that could, of course, be available in the fall, pneumonia, for example, or whooping cough. And so let's take advantage of all the vaccines, especially influenza. It's such an important focus right now, and we have a tool available. And another thing to say about influenza is that influenza vaccination rates are only about 50% of people in the United States get vaccinated. So we need to raise these rates, and influenza vaccination can, of course, not only help protect us from getting influenza. There's data to show that if we were to get a case of influenza, it could be less mild. And of course, if we don't get influenza, we're not spreading it to other people. And so it's not only for ourselves, it's also we want to get vaccinated to protect those around us, our elderly parents, our very, very young children. Maybe there's somebody in our household who's immunocompromised. And so important this year.
And the pharmacists stand ready and willing to provide these vaccinations. We're thrilled that now pharmacists can administer not just flu vaccines, but all vaccines down to age 3. And pharmacies have ordered additional flu vaccine to be able to meet those demands and provide additional vaccinations than was given last year. We know the access points that pharmacies are for vaccines. Many people get them nights and weekends. And that's when the pharmacists are accessible. And in many communities are the only healthcare provider available. So we're excited. We're ready. Pharmacies have retooled their operations to make sure they're keeping their patients safe, keeping themselves safe, taking into account social distancing and not mixing sick people with well people. So really excited to be a part of that effort this year.
Yeah. And Debbie, just to add, absolutely, because I get this question. Well, the question is, is it safe for me to go to the pharmacy and get vaccinated? And of course, the answer is absolutely yes. Many systems are in place, and thank your community of pharmacists to be making it safe for people to be vaccinated with the proper procedures, social distancing, masks, hand washing, etc., curbside tents, whatever it takes. That's what's happening, and so we're showing how as a community, we come together to make it such that we can make it so that people can come get vaccinated safely and keep themselves protected. So I want to thank your community for doing this. So important.
And we're thrilled to be a part of it. The flu season is fast approaching. And we've been told that it's critical for everyone to get a flu shot this year. We're hearing that getting the flu vaccine may actually help mitigate some of the devastating effects of COVID. Help us understand how one shot may help us stay safe from a virus we haven't even been inoculated or been exposed to yet.
Yeah, so that's an interesting topic. So the general approach here is that we just need to keep ourselves healthy. And so if we get one disease where potentially our immune systems are declined as we're looking to fight off that disease, we potentially could be at risk for another disease. And if it comes along, we get that disease in a different way than if we were healthy before we were exposed. So we want to keep ourselves healthy. And the other thing that the importance of influenza, we touched on this a bit earlier, was that we don't want to be unnecessarily around other sick people. So if we get influenza and we need to receive treatment by either our doctor or our pharmacist, for example, we're potentially then around other sick people we could get that other infection because we're around other sick people who might be in that environment. And so, and the other thing is we don't have data yet. What happens if you actually get both infections at the same time? We just don't know. Fortunately, when COVID started, it was in the March, April timeframe here in the United States, and the flu season was on its way out from last season. So we just don't know. And so why find out? Let's just get ourselves protected against influenza and all the other vaccines that are recommended for whatever age we are, which can all be given at the pharmacist. And that's critically important. We don't want to miss the opportunity.
So as we are getting ready for flu and COVID to collide this fall, early next winter and such, I think one of the questions I know pharmacists have is what have you seen or heard as it relates to flu vaccine and a COVID vaccine that we're anticipating either late this year or early next year being given together around the same time, not necessarily at the same time, the same arm, the same day, but in general, having both of those vaccines given simultaneously?
Yeah, so that's an important question as well. And there we're going to need to have guidance from the Centers for Disease Control. They will evaluate all the evidence that was collected during the clinical trials with the candidate COVID vaccines right now. And then they will make an evidence-based recommendation based on the totality of the data and how best to operationalize vaccination in the fall. And so we just have to wait and see. But let me state that right now, influenza vaccines are available and, of course, can be given. And there are no COVID vaccines right now, and there will not be COVID vaccines, in the very, very near future. So let's take advantage and get everybody vaccinated with influenza, and then not even have to deal with that question. But we'll get the guidance from the CDC and the Advisory Committee on Immunization Practices around that question, and it's going to be built on the evidence, and then we'll go accordingly.
Good point. Absolutely. We're here and now. We've got the flu vaccines in our pharmacies, in our physician offices and other places. So let's utilize them. Let's get them today. So I'm going to ask you now, I'm in Austin, Texas, and Austin is a college town. And maybe could you speak to the need to be vaccinated for other things such as meningitis? And is it necessary that in Austin or elsewhere, people get meningitis vaccines, for example?
Yeah, so let's speak about meningitis vaccines in the state of Texas. So there are two different types of meningitis vaccines. You're talking about the Neisseria meningitidis vaccines, and I'll explain what those are in just a minute, but you know them, the meningococcal ACWY and the meningococcal B vaccines. So the Centers for Disease Control recommends that all adolescents at around age 10 get a meningococcal ACWY vaccine, and then a second dose at around age 15. There's also the meningococcal B vaccine, which is the serogroup of Neisseria meningitidis that's causing the majority of invasive meningococcal disease in the United States, particularly among adolescents and college-age students. And that vaccine is recommended using what's referred to as shared clinical decision-making, which is a dialogue, a discussion between the healthcare provider and the patient themselves. And based on that, the shared clinical decision is recommended vaccination for MenB for adolescents starting at age 16, so between 16 and 23. And so meningococcal vaccination is very important. This is a disease that, thank goodness, is uncommon, but it comes on suddenly and unexpectedly and can be life-threatening, sometimes within 24 hours of onset. And this is a disease that we don't want to treat when it happens. We want to prevent it before it starts. And so it's very important that our adolescent population and our college-age students are protected against invasive meningococcal disease. You asked about other recommended vaccines as well. So, of course, for adolescents, we're also speaking about the importance of human papillomavirus vaccination with the Tdap vaccines to prevent pertussis, tetanus, and diphtheria. And then as we move into adults, because I'm not going to touch on the pediatric vaccines, but as we move into adults, of course, now we're looking at shingles vaccination for all people over age 50. Of course, the influenza vaccine for everybody every year over age 6 months, pneumonia vaccination for people over age 65, and then also the Tdap vaccination for adults who hadn't been vaccinated previously. And then let's also remember about pregnant women. So it's important to counsel a pregnant person who's in the pharmacy to ask them, have you spoken to your primary care provider who's managing your pregnancy about the importance of influenza vaccination and Tdap vaccination, which are the two vaccines that are recommended during pregnancy for pregnant mothers. So we don't want to miss the opportunity. That's really the critical thing. I think as we move into the fall, and we expect that diseases are going to circulate like influenza. We know about the respiratory diseases that circulate in the fall. Let's keep ourselves as healthy as possible so that we don't have to go to the doctor's office or the pharmacy with a runny nose and a cough and be around potentially other sick people or spread something to somebody else. And that's the importance of vaccination. So I would recommend that whenever we have a patient encounter, to take the few minutes to ask them, are you aware of the vaccines that are recommended? Let's say it's an adult. Are you aware of the vaccines that are recommended for adults? And run through what they are and then answer their questions and say, we have those vaccines available here today. And if they're not interested today, then make sure they either come back or go see their healthcare provider if that's where they prefer to be vaccinated. I mean, their doctor, of course, pharmacists are healthcare providers. Wherever they feel comfortable to get vaccinated, we don't want to miss the opportunity to make that recommendation if they don't want to do it right then and there in the pharmacy.
Well, you kind of went into my next question where I was going to say pharmacists definitely understand that all vaccines are important. But from your perspective as a physician, which ones can the pharmacist be most helpful in promoting? And I think, kind of thinking about those that are lacking, just to restate, you had mentioned Tdap, HPV, meningitis, and then for adults, the shingles and the pneumonia. Of course, flu is important. But anything else you think that there's a lack of right now that pharmacists can really play a role to truly promote?
Yeah, absolutely. I know all the vaccines are important. Right now, our priority should be influenza vaccination and then making sure we're up to date on all the other vaccines that are recommended. Adding to that list is also the hepatitis vaccines. Both hepatitis A and hepatitis B are recommended for adults, whoever wants to be vaccinated, and then based on underlying healthcare conditions such as diabetes, as an example for hepatitis B vaccination. People who are experiencing unstable housing situations, very important that they be vaccinated as well if you have the opportunity to speak with them and provide that guidance. And then there are various travel vaccines, of course, which are important for people when we get to that point again where we can safely travel. Very, very important. I think you've covered the majority of them, but in answer to your question, what's most important? I'd say they're all most important. But I do want to focus that right now, the Centers for Disease Control's most important vaccination is going to be influenza as we move into the influenza season. And then I would just highlight again, because I know that adult vaccination rates have fallen during the pandemic. So while younger people are going back to their doctor's office and receiving, well visits in their immunizations, we're seeing we're not seeing this recovery with adults. So to make sure that adults also get their shingles vaccination, if they haven't had their Tdap, and also the pneumonia vaccine for people over 65, very important.
Absolutely. Well, Lynn, thank you for your insights. So much good information. most definitely, we heard loud and clearly, right now is the time. Get your flu shot and get up to date on all the vaccines. And for pharmacists, don't miss an opportunity to talk to your patients when they're right there in front of you. To our audience, thanks for joining us. We appreciate you. Please be sure to hit the like or subscribe button to get notification for future episodes like this. Thank you and have a great day.